Hi everyone, I'm Yo and this is Virginia. Welcome back to our YouTube channel, Knowing, Caring, and Loving Your Lady Parts. So we're super excited today because we have our first Q&A video, question and answer. And here's the question for you. Have you ever wondered when you're getting sexually involved and intimate that something that might be going inside the vagina or penetrating you may not fit? Or if this can accommodate a certain size? Has that ever been a question for you? Men and ladies, of course. And also the second question that was imposed was, what happens in the vaginal area when a woman gets sexually aroused? What's actually going on in there? And also, what happens to those pelvic floor muscles? You know those muscles that I talk about all the time? See the link above, right? That are important for your sexual function and also for peeing and pooping or not peeing and pooping. What happens to those muscles? Do they get looser? Do they get tighter? And what is their actual function in terms of your sexual pleasure? So stay tuned because I'm going to answer all those important questions for you. So let's get started. Welcome to anyone who's new to the channel. And please, if you're new to the channel, please don't forget to hit that subscribe button and click on your notifications so you get all my videos. I release a video every Wednesday and share with your friends to help support the channel. And we really appreciate it. So first question, what's the normal size of the vaginal canal? The vagina, basically, that tube, you know, the elastic tube. Well, normally it's between about 3 to 5 inches, more on 3 inches. So if you're looking at your hand, maybe from knuckle to knuckle, or if it's a longer one, it can be maybe the size of your hand, but I've found around 3 inches. So that's not very big if you think of the average size of a male or anything penetrating is usually a little bit bigger than 3 inches. So what exactly happens during sexual arousal for women? And should you be afraid if something is going in that's a little bit bigger than 3 inches? Well, no, you shouldn't be afraid because the vagina is actually an elastic tube. So imagine, I mean, you have a baby and a baby is a little bit bigger than a male penis or a device that might be going in, usually with the big head and everything. And it's very stretchy and muscular, right? So it accommodates a lot of things. And the length of it actually enlarges when a woman gets sexually aroused. So it's so important to have foreplay and be sexually aroused so this can happen, so you can accommodate whatever is going to be penetrating inside the vagina. So what happens to a woman vaginally when she gets aroused? Okay, so of course when a woman gets aroused, she becomes more lubricated. And how does that lubrication happen? Well, the vagina gets lubricated from glands inside, and that's important because a woman needs that, of course, to become sexually aroused. And the more lubricated she is, the better it is with respect to anything penetrating and reducing friction inside. The area engorges with blood, and of course there's more increased lubrication, which is always great for women and men. And what happens is the opening of the vagina, which is called the cervix, as you remember, it actually sort of moves out of the way. So it actually gives more space for whatever's entering, so it doesn't hit it and block it and cause pain. There's also an area called the pouch of Douglas that sits behind the uterus. So imagine this is the uterus. Well, there's a pouch there that sits behind towards your back, and there's also one in the front, but there's more room in the back, and apparently it can be quite lubricated too, which is great. And that's often where the penis or the object that's trying to penetrate in the vagina will slide into. And also because the cervix is moved away, that creates a little bit more room, and that's towards the back. So most often you can accommodate a size that's a little bit longer than 3 inches without any problem. However, if there is any pain during intercourse or it seems to be hitting something, well, of course, talk to your partner. You can try a different position because maybe you need to sort of move your pelvis a little bit. So here's your pelvis. Maybe you need to angle a little bit more, lift your bum up, or try a different position so that object or the penis can slip behind the uterus into that little pouch or area where there's a little bit more room for it to slide. Right. So the vaginal canal does expand to accommodate during arousal for a woman. The other thing that's important is with respect to the increase in blood flow and what happens during sexual arousal with a woman for their clitoris. So remember with the clitoris video, and if you haven't, have a look above. Remember the clitoris is quite big. It's not just that external part that Vaginia is sporting today with this little button here, right? So this is the clitoris on the outside, the vulva. But remember internally, it's actually got like a wishbone shape. It's actually big legs that come all the way and they envelop the vagina and also inside the labia. And when this area gets engorged with blood, when you're sexually stimulated and aroused, right, everything gets more lubricated and you start feeling everything around the area. So that's pretty amazing, right? And so here's my wishbone, that my replica of the clitoris, and I haven't gone into my 3D printer yet. So remember, there's the outside and then there's the legs, and imagine that whole area. And remember, the clitoris has more nerve endings than a penis, and it gets completely engorged with blood, right? And that can enhance that area. And then the pelvic floor muscles also play a role in that, which I'm going to talk about in a second, okay? So the other question then is the pelvic floor muscles. So remember, and if you don't, remember, look at the videos above in terms of pelvic floor muscles. These are really important for men and ladies. So with respect to ladies and men, it's important with respect to urinary incontinence, fecal incontinence. So you're peeing, you're pooing, and also your sexual health and function and overall health, right? So with respect to pelvic floor muscles, if you have a better awareness of your pelvic floor muscles for ladies and men, and those are those Kegel exercises, and again, you can refer to the link above in my videos, and that can enhance your sexual experience awareness, and also potentially can enhance your orgasm for women. So the reason being is the pelvic floor muscles, when they contract during an orgasm, they'll increase your awareness of the muscle and also enhance that orgasm. And also with the clitoris and everything together, can you imagine enhancing that whole area as opposed to just a small part? And the other question with respect to the pelvic floor muscles was, during arousal, are these muscles actually loose or tight? So here's the thing, you need these muscles to be relaxed during penetration. And I've covered a lot of that during my videos, during pain, during sex. And again, you can refer to the links to the other videos, why sex hurts. So this muscle needs to be relaxed for actual penetration, because you imagine if it's closed like this, it's just going to block whatever's penetrating and it's going to hurt. So you need to relax this muscle. So when you're getting aroused, it helps you get relaxed. It actually relaxes everything and decreases anxiety, and it encourages things to go in, and of course encourages the lubrication. And then as you get stimulated, and of course before orgasm, then this muscle can tighten once things are in. And then yes, this muscle will tighten and during an orgasm, and that can enhance your sexual experience. So I hope that answers your question a little bit about the pelvic floor muscles, what happens during arousal. Okay, so it goes through a little bit of a phase. If you have pain during sex, then you need to relax those muscles. And if you want to heighten your awareness, then it's important to work these muscles and do your Kegels, because that will hopefully enhance your sexual experience along with everything else like foreplay, and also communication with your partner is really, really important, because that only enhances the experience for you, and they can do what you like and what turns you on and pleasures you. And of course, as you know, I am a pelvic floor physiotherapist, but I am not a sexual therapist. So if you have any problems, please refer to a specialist in this area that can help you further. Thanks everybody for tuning in with Vaginia and I to our first Q&A session. We always love having you. And we hope that answered a little bit about your questions with respect to the vaginal canal and during arousal and what happens to those important pelvic floor muscles. And as always, please comment below and let us know what you want us to cover in these videos. We want to upload topics that you're interested in and you can learn from, because we love sharing with you, and that's why we're here. And please don't forget to hit the like button and also share with your friends and help us support the channel so we can keep providing these educational, fun videos. And of course, we look forward to seeing you again soon.